you were a minute behind already.
Just a minute.
He's our clock keeper, so, which means I better get whacked.
The timer going. Governor, thank you so much for joining us this morning. So you're joined today by our Behavioral Health System for Future Generations Commission. We do have most members here in the room with us, several online this morning, and also members of my team at DPHHS who've worked tirelessly over the last year and a half to bring the report that is before you to light. So before we begin our presentation, I'll turn it to you.
Okay,
Governor.
thank you, Director, and sincerely, thank you to all of you for the work you've done. This has been a monumental task, and you've taken the challenge and delivered, and we're very appreciative. I want to thank you each for making the trip here today. Last June, working with the legislature, I was proud to sign into law House Bill 872, and it made really a historic $300 million investment in behavioral health, really record-setting. And when we set out to create my budget for Montana families, we knew we had to transform community-based behavioral health services in the state and care for people with developmental disabilities across the entire state. And I want to thank Representative Keenan and Senator Est for your work in leading that effort. And thank you to all the commission members for your voice and expertise in bringing these recommendations together. After decades of previous administrations really applying Band-Aids, kicking the can down the road, we knew we had to make a big investment here. And I'm proud to report today that you all have followed through on the commitment we made to Montanans and with this generational investment in our communities to help people get healthier. This commission has done really excellent work, and you should all be proud of the results that we've generated. You all led the way with the help of countless Montanans, and we're here today really to celebrate the work that you've done in this report. So thank you again to all of you, to the community stakeholders who provided voice, the tribal partners, medical professionals, people with lived experiences that contributed to your work, law enforcement, and various other subject matter experts that you've sought out and gained their expertise and wisdom. Together you've made this historic project a reality. So I think you deserve a round of applause. Join me. To be clear, Montanans know their healthcare needs best, and you all listen to them in developing this report to identify ways to reform and improve Montana's behavioral health system and services. The numbers in the report are really, truly impressive. In here, you have 22 recommendations. Also, while they can't all be implemented all at once, you did identify 11 near-term initiatives that we can act on. Many we've acted on already. For example, $56.8 million to increase residential bed capacity in Montana, $6.5 million in grants to tribal nations for behavioral health services, $7.5 million for a mobile crisis response services. And just last week, working together, we approved $2.5 million in grant funding to support specifically our rural communities. I want to thank you for investing in a stronger future of care through these recommendations, while also addressing the immediate needs of our communities through the near-term initiatives that you've identified. So just in closing, today is truly a celebration of the work that you've completed and the difference it's going to make in people's lives across the state. It marks the end of one chapter, and as the impacts of these investments begin to take effect, we're going to see the beginning of a new chapter where we have more services available to help people in need. There's still plenty of work ahead. We're not done here, but you've given us a plan, and for that I'm very thankful. While your work continues, we must also keep plowing ahead to bring this report to life and actually implement the recommendations. The good news is that now we have a Made in Montana plan that we can implement for behavioral health. I congratulate you all for getting us to this point. You should be very, very proud of the work you've done. And with that, I'll turn it back over to you, Director.
Thank you, Governor. So today you'll hear about several of the recommendations that are contained in the final report from both commissioners and commission leadership, as well as department leaders around the room. As you know, the commission's final report has been more than a year in the making and relied heavily on input from a wide range of Montanans. It's been a very unique and rewarding bipartisan effort that ultimately builds on the HEART initiative that we successfully launched in 2021. Over the past 14 months, the Commission held 12 statewide meetings and received an extraordinary amount of input and public comment and testimony from Montanans who are extremely committed to overhauling and rebuilding the state's behavioral health and developmental disability service systems. We've experienced a lot of energy and excitement across the state, and that too has been very rewarding to see. We've also had fantastic representation on our commission. So it's a diverse group of commissioners. All commissioners have dedicated their expertise, their time, their passion to the process, and I could not have asked for a better team. Our DPHHS colleagues in the room, and I should turn and look behind me as well, have also done an outstanding job and poured many, many, many hours into this project, in addition to overseeing their daily duties and responsibilities. Over the coming year, and with your support, your continued support, DPHHS will continue its implementation and support of the near-term initiatives, or NTIs, that you have already approved, in addition to advocating for sustainable long-term funding for the foundational recommendations that we will discuss with you today. And Governor, I'll close by sharing that we would not be here today without your unwavering support and commitment to this historic initiative. On behalf of the Commission, on behalf of Commission leadership, and the Montanans that we serve, I express my sincere gratitude to you. And with that, I'll hand things over to Chair Keenan.
Thank you, Governor. I have a few additional thank yous, but first of all, I can't thank you enough and speak for Senator Esp and I have been waiting for this moment for a long time and really appreciate your support for 872. Director Barrington, we've had a great time doing this. We've had a lot of laughs, we've had a lot of challenges, but tremendous leadership that is recognized by all of the employees in DPHHS that I've talked to. Very inspirational. The commissioners, thank you very much for putting up with me and for all of your contributions. I think we've done the impossible, and that's what we were told we were doing. We were going to do overwhelming and impossible. Well, we've done the impossible. I look at today as kind of a commencement. It's really a beginning. We've set the stage for the future. We began meeting on July 20th of 23. We had 11 meetings across the state, Havre, Kalispell, Helena, Billings, and then I've been to a lot of other communities. I mean, everywhere from Superior to, everybody always says Eureka to Ekalaka, but I'm going to say from Wolf Point to Superior. Our first task was to establish our priorities that you'll see at the beginning of our report. They were to guide us as our North Star to ultimately come with our 22 recommendations. I have a big thank you and recognition for the staff at DPHHS. They worked 7 days a week, oftentimes dealing with me on Sundays, but I really appreciate the energy, the passion, the trust that they had to work to improve people's lives. And then the ultimate thank you to the hundreds of people that we all interacted with across the state of Montana and participated in subcommittee meetings. Hundreds and hundreds of people helped us get to this point. So thank you to everybody. Rebecca.
Thank you, Representative Keenan. And I just have to echo all of the thanks, particularly to you, Governor Gianforte, Charlie, Representative Keenan, and Senator S. As the former administrator for the Behavioral Health and Developmental Disabilities Division, I truly experienced every day the complex needs of this particular population. And it's to such a degree that approximately 22% of the Medicaid budget goes to supporting these two special populations. So very excited. This is really the first time that this population has received the funding and the attention that it deserves. So very grateful and honored to be part of this process. Taken together, the 22 commission recommendations address each of the commission priorities, serve every population within these two systems, and incorporate input from a diverse range of stakeholders, including individuals with lived experience and their family members. And thank you to Representative Keenan and Senator S. for really ensuring that we had those folks at the table. So the 17 behavioral health recommendations aim to improve case management by enhancing a person's ability to navigate the continuum of care, to ensure real-time access to the appropriate level of care that they need. They expand the number and kinds of services available across the behavioral health continuum, and they incentivize people to join the behavioral health workforce. As we all know, the workforce is the backbone of all of these great services. The additional 5 recommendations focused specifically on the specialized needs of those with developmental disabilities. And they focus on increasing entry points to the service system to better support families and individuals who are looking to access care. They modernize the funding of service systems to support person-centered models of care, while at the same time increasing provider flexibilities and sustainability. And finally, they expand the array of services that are available to provide enhanced options to better meet the varied needs of individuals with developmental disabilities and their families. And on that note, I will hand it over to Patrick Madison, who is the CEO of Flathead Industries and was a very powerful advocate for folks with disabilities.
Thank you, Rebecca. Thank you, Governor. Serving on this commission has been an absolute honor. Thanks to Director Barrington and my other fellow commissioners, it's been fantastic, as well as thank you to all the support from the DBHHS staff. The Developmental Disability Program oversees an active service array to meet the supports of individuals with developmental disabilities from birth until death. Developmental disabilities are lifelong and often require comprehensive supports to assist individuals with activities related to health and safety, daily living, and achieving quality life outcomes. Federal requirements like the Olmstead decision, the home and community-based settings rule, and the newly published access rule provide strict guidance to program operations and direct systems to focus on promoting community-based care and moving away from institutionalized care. Community-based supports for individuals with DD are provided through a 1915C HCBS waiver for individuals eligible for services managed by DDP and approved by CMS. Through this waiver, known as our 0208 comprehensive waiver, DDP offers a comprehensive service system, including over 30 services ranging from residential habilitation to day services, supported employment, and many other support services. I'd like to highlight one of the 5 DD recommendations. Refine and reconfigure the 0208 comprehensive waiver service rates seeks to implement a standardized assessment tool that can measure level of complexity and support needs and re-engineer the reimbursement model for services to account for the level of acuity and support needs. This will ensure that providers are more appropriately incentivized to support individuals with complex needs and that the needs of individuals with DD are better met by service reimbursement rates that are more aligned with their unique needs. I'll turn it over to Representative Binkley.
Oh, thank you very much, Governor, and thank you, Commissioners. And I will let Representative Yakovich continue.
All right, thank you, Representative. And thank you again, Governor, for your courage and your trust in us. And it's amazing, your leadership here has been a real inspiration, and one reason is because they included us in all steps along the way. They were collaborative and they communicated with us, and I felt like we formed almost a family. And these two young men here, Representative Keenum and Senator Esp, have been great leaders for us and great mentors for all of us, so thank you. I'd like to share, Governor, about number 6. We're going to be talking about targeted case management. And this was a clarion call because visiting constituents, going to group homes, over 30 different organizations I met in Billings alone, we discussed the need for targeted case management. And that is where we are there to help people through therapy, helping them, even almost holding their hand or guiding them through transportation or respite care or just doctor's appointments. Within DPHHS, the Behavioral Health and Developmental Disabilities Division works to implement and improve statewide system of prevention, treatment, care, and rehabilitation for Montanans with mental disorders, addictions to drugs or alcohol, or developmental disabilities. Access to behavioral health services has long been a challenge in Montana, with a severe shortage and an ongoing shortage of providers challenged by the impact of COVID-19, particularly in remote area, in we would call frontier America, frontier Montana, I would call, of mental illness in the country. Despite these challenges, the Behavioral Health and Developmental Disabilities Division provides community partners and advocates have continuously worked to enhance the state behavioral health system through initiatives that strengthen prevention, treatment, and recovery services. Therefore, Governor, recommendation number 6 enhances the target case management program, aims to reevaluate the current target case management reimbursement model for all target case management services, expand the target case management program, service availability, and current met and unmet services needed and support, and incentivize programs to measure outcomes on a path toward more value-based models. This will result in decreased utilization of avoidable, high-cost services for people receiving targeted case management. It's a home run, Governor. Increased utilization of prevention care for people receiving targeted case management, and increased access to community-based services. It's a very inspiring part that we've achieved through our event. And they only gave me 3 minutes, Governor, so I'm going to now move it on to another colleague of mine, Representative David Fern.
Thank you very much, Representative. He's very hard to outdo, and you should have witnessed him on the floor at this time. But without getting too big of a head, I want to echo everyone else and say thank you, thank you, thank you. It took some courage to go forward with this to sign House Bill 872, so great credit for doing that. The people around this table, most of us, and people out there in DPHHS land, our moms and dads, my colleagues to the west of me and across, along with me, we've been school trustees. So we understand the role of schools and how it can potentially assist the behavioral health situation we have in the state and provide preventative measures. We're also very sensitive to the ask we're making because we realize these are sensitive issues and we have to sort through the views of parents and how they will accept or not accept the services we ask. We also have to be very sensitive to our staff and make sure that what we're asking is not come down as an unfunded mandate, as their plates are very full already. But it is very important. So I'll briefly just describe what this recommendation is. This is recommendation number 18. Invest in school-based behavioral health initiatives, seeks to identify priority communities for continued investments in existing school-based programs and release funding for one-time investments in school-based multi-tiered system support to include universal screening, referrals, in evidence-based interventions that support youth well-being. Additionally, this recommendation will enhance the supportive environment of schools through interprofessional training for school counselors, nurses, psychologists, social workers, administrators, and other professionals. Last, working in partnership with the Office of Public Instruction, the department will determine the right policies and identify funding sources to ensure sustainability. This recommendation will increase utilization of Medicaid behavioral health services billed by school districts and increase preventative and supportive behavioral health services by youth, especially those at risk. Schools are an ideal setting for delivering interventions because they make delivery efficient and less expensive. Focusing on prevention, better early detection, and appropriate treatment during childhood will change the life trajectory of generations of Montanans. With that said, I think I'm going to turn it over to Megan Peel, or is Senator going to?
Representative Binkley.
Well, excuse me, Representative Binkley's going to take it. Thank you.
Thank you, Representative. Recommendation number 8 is to implement the Care Transitions Program, and it aims to design and implement a care transition service for individuals discharged from institutions that facilitates reintegration back into their communities while identifying and securing federal funding options for long-term program sustainability. This recommendation will ensure that individuals discharged from psychiatric hospitals have a tailored discharge or reintegration plan and will increase post-acute appointment attendance and community connections. Additionally, this will reduce readmissions for people discharged from psychiatric care and reduce the length of stay for individuals readmitted to a hospital. Very important. Thank you.
Thank you, Governor. I'm Megan Peel. I'm the Interim Administrator for the Behavioral Health and Developmental Disabilities Division, and it has been a great privilege and honor to work on this project, and I thank you for your support and the trust that you put in me and our team at DPHHS to work on this with the commission members, and thank you all for your time and thoughtfulness in this. The near-term initiatives that are recommended by the Commission and approved by you, Governor Gianforte, are separated in this report's recommendation and are fundamental and immediate solutions that DPHHS has taken action on and will continue to take action on under the Commission guidance. The Commission used criteria to identify near-term initiatives that focused on specific known and worsening problems within our behavioral health and developmental disabilities systems and deployed funding to address those problems while identifying a path towards sustainability in the future. We looked at those that built upon existing DPHHS programs or infrastructure whenever possible. And lastly, the Commission has used a structured process to refine and advance a selection of recommendations for initial implementation under House Bill 872, which you'll see in the report under the sequencing section. This process was designed to build incrementally upon each step and serves as a strategic foundation for implementing these recommendations. Recommendations were organized using complexity and impact and categorizing them and looking at their anticipated benefits. Phase 1 recommendations are foundational recommendations which build needed infrastructure for subsequent recommendations to succeed and are critical to strengthening and sustaining our existing systems. Phase 2 recommendations are Commission-identified focus areas. These may be impacted by the completion of a foundational recommendation. And then Phase 3 recommendations are secondary and have been identified as key recommendations and value add to our delivery system, but have less of an immediate need or impact on our systems. So thank you again, and I'll pass it to Senator Esp.
Thank you, and thank you, Governor. Before I start, I just want to recognize one of the people you appointed to our commission, Commissioner Lindau, is on the screen here, and she was a valuable part of our efforts and brought perspectives that some of us didn't have, so we appreciated that. Governor, echoing Representative Keenan's comments, I've waited a long time for this to come along. I came here in 1999 with a mission to lobby legislators to improve mental health services. I met at that time with Representative Senator Keenan and Representative Caston, Senator Swizgood, Senator Waterman, and they were like the mental health caucus of that time. And I will say that Representative Keenan hasn't changed a lot in those many, many years. He's a model of approachability and unbounded enthusiasm. I couldn't say the same thing about Senator Swizgood or Representative Caston. They had a gruff exterior, but as I got to know them, underneath that, they had a heart for the same people that we have a heart for. So I'm proud of the work the commission has accomplished. This is where the work starts. We are finishing the planning stages. We need to widen the circle of people that understand this work and that are committed to supporting moving this agenda forward for the people we want to serve. Before you is a blueprint, a multi-biennium plan, something I've never seen around here in my time up here. We need to move forward in a measured way to make improvements as quickly as we can within the resources that we have available. Securing buy-in from legislators during the next session, not going to be easy, but that's our job as commissioners, as leaders, to move that bar forward on behalf of the families that we represent. These populations have been under-prioritized for too long, and now is the time to change that. We've heard from many people throughout this process that we engaged in, and I can tell you people are watching, people are listening, people are engaged, and they're excited about our work. And I think that momentum will carry forward into the next legislative session. Although the behavioral health system has faced many challenges, as you know, throughout the years, the service system still has a strong foundation. We recommend that you build off that foundation by supporting the thousands of Montanans that need our help and the future generations of people that will need our help. The charge embedded in our work was to address gaps and identify recommendations to improve these two systems. I'm excited about the future impact that these recommendations will have on those systems. Governor, we're excited to turn this report over to you for our continued work together. Please treat it gently. Our families are dependent on us.
Thank you, Senator Rasp. Governor, that concludes our presentation to you this morning. And again, we're extremely grateful for your time and look forward to starting this next chapter with you.
Yeah, and I'll just conclude, Senator S., I appreciate your decades of work on this issue, and for all the commission members, it's critical that we provide the services for the people that need it. Every Montanan deserves to live their best life, and it's with this blueprint you've given us, we have a plan to go forward. So,
Thank you.
I look forward to the next chapter. Thank you again for all your work.
Yeah.
Thank you, Governor.
Yeah.
Thank you.
All right, thank you.
Yeah.